Hello everyone, my name is Austin Winters. This presentation is about immigrant farm workers exposed to DDT in the United States. We'll talk about a little bit of the history of DDT. DDT was a commonly used pesticide for insect control, along with controlling malaria, typhus, body lice, and the bubonic plague. It was believed that DDT would get in these insects' stomachs and make them explode, ultimately protecting the agriculture. DDT was once considered a wonder chemical. It was very cutting edge at its time, and it was a very cheap product that had great impact to be such a cheap product. There was a very low toxicity towards mammals, and it had a very long duration of activity. It could be effective for a very long time. It was found out that DDT had an effect on humans through the foods we eat, the air we breathe, and it was banned in 1972. There were many issues with DDT, even though it was deemed a miracle drug, being heavily used in earlier years. There was little to no research on the effects of DDT for humans, which led to the high use of DDT in our agricultural fields. These farm workers were exposed to DDT by handling the crops, breathing the contaminated air, and touching any contaminated products. Also contaminating their families and friends or whoever they interacted with, because most farms did not have access to sinks or showers or clean clothes, and these farm workers went home with contaminated skin and clothes that would ultimately expose others. Population distribution for those exposed to DDT consists of both genders, men and women, with age averaging 31 years old or younger. Most of the migrant farm workers are predominantly Mexican-born sons, husbands, or fathers. These are where the highest risk of DDT exists. While there are many solutions to DDT exposure, DDT use has been banned in the United States. However, we still must protect our farm workers in case some of the farms continue to use DDT. There must be showers on site where these employees can wash their clothes and be sure that they go home clean to their families without exposing them to DDT. Masks must be worn when working on the farm, along with no exposed skin during work hours to prevent exposure. There must be a program developed for those who have been exposed to DDT to form a support group where we can all work together to help each other. There should also be health services to treat and screen those exposed to DDT for cancers. There must also be training for the farmers, so we are well aware of how to keep our farm workers safe. We must ensure these farm workers are not only safe while doing their jobs, but also safe when they go home by not exposing their families to these chemicals. Thank you for watching my presentation.